So guys, metformin is one of the most common diabetes medication and also considered a first-line medication. It works by a couple of ways, three actually. First, it actually increases insulin sensitivity, meaning that the body is able to utilize insulin better and less amount of insulin is needed to control the amount of carbohydrates, the amount of sugar. Next, it decreases the absorption of sugar in the intestine, and then it also reduces the production of glucose within the liver. So three mechanisms, very helpful. So now that is all well and good, but what could be the adverse effects of metformin? I'm going to break it down into the common adverse effects and the not so common but the severe adverse effects. So the most common problem with metformin or glucophage, another name for this medication, could be stomach upset, diarrhea, gas, and metallic taste in your mouth. This is a fairly common complaint. One way you can reduce this is by increasing the dose of metformin gradually. Do not go on a heavier dose, start off gradually. And excessive gas and diarrhea, that can also be prevented if you start off the medication gradually, and also if you take the extended release version, meaning the medications you can take once a day, you don't have to take it twice or thrice a day. That could help out. Now, a severe side effect of metformin could be something called lactic acidosis. This is when acid builds up in your bloodstream, and this could be significantly dangerous. And how can you tell that you are having lactic acidosis? Let's talk about that right now. So one typical sign of lactic acidosis is that you're breathing heavy. You're really breathing heavy. You're basically trying to blow away all the acid in the form of carbon dioxide through your lungs. The next you could have is nausea, vomiting. This could be significant. You could have dizziness, lightheadedness. Chest pain can also be a part and parcel of lactic acidosis, severe lactic acidosis, so be careful. So those were some of the side effects of metformin, but some precautions you should take in certain circumstances. For example, if you're getting a contrast study, like you're getting a dye with your CAT scan or your MRI scan, then this could be a significant problem because metformin can cause kidney damage, especially if your kidneys are weak to begin with when you're getting these dyes, these contrast studies with your MRI or CAT scans. Next guys, when you are on metformin, you should not be consuming excessive amounts of alcohol, and alcohol for diabetics is no good to begin with in any case. And if you do consume lots of alcohol with metformin, you have the chance of developing the dreaded lactic acidosis, which we just talked about. Now, when should we take metformin? So if you are on any medication, you should look to take it always at the same time every single day. That always helps. With metformin, what you could do is take it with food, because then you will reduce your stomach side effects. That will be fairly important, to take it with food to reduce any of those dreaded stomach side effects such as nausea, abdominal pain, metallic taste in the mouth. That could happen. So how should you store metformin? Metformin is stored in room temperature. That is fine. You don't need to put it in the fridge. Okay, so just took a boat ride here. It is called the St. John's River Taxi.com. St. John's River Taxi.com. So now, just to finish up, so the dosages, the regular short-acting metformin actually comes in 500, 850, and 1000 milligrams tablets, but the long-acting extended release comes in 500 and 750 milligram tablets. So that was all about metformin, but I like if my viewers treat their diseases naturally, and check out my other videos on natural control of diabetes and your sugar levels and the supplements that we can take for the better control of diabetes. Anyways, let me know if you have any other medications you want me to talk about. Also, let me know where you're watching this video from. I'm making this video from Jacksonville, Florida. I'm on vacation here, but I wanted to make sure I get a few pieces of information out for my viewers. Thank you so much. Talk to you guys soon.